Hi, I'm Dr. Melanie Ornstein. I'm an obstetrician gynecologist. I'm going to talk to you about periods. Everyone gets a period. All females get them. Female mammals, dogs, cats, sheep, tigers, baboons, you get the picture. All female humans get them. If you're a girl, you're going to get a period. There's lots of different phrases that people use to describe the monthly period or menstruation, like time of the month, on the rad, code red, lots of different slang terms. Periods are normal and natural, and again, if you're a girl, you're going to get a period. The average age that people get their periods is around 12 and a half. Some kids get much younger, 10 or 11, and some young women are going to get them older, 14 or 15. Periods are part of puberty, which is part of becoming an adult woman. Puberty means you get taller, you start to get breasts, and pubic hair, and body odor. And if you become sexually active when you have your period, you could get pregnant. When girls first get their periods, they may initially be irregular. At the beginning, you can occasionally miss periods. Periods can be irregular for 12 to 24 months after your first period, and sometimes even longer, up to 2 to 5 years. But eventually, most girls get a regular, predictable period every month. On average, periods last 4 to 7 days. Bleeding can be varied, light, moderate, heavy, and some people will have painful periods. Some people's periods are just heavier than others, but occasionally it may represent a problem. If you miss a few cycles and then you get your next period, it can be really, really heavy, and it may signal an underlying hormonal problem. Sometimes people can have an underlying bleeding disorder. You get easy gum bleeding, nosebleeds. Anybody in your family have a bleeding disorder? If you're worried, you need to speak to your doctor. Sometimes some of the pain medications in the NSAID family, like ibuprofen, Advil, or Aleve, Motrin, they may decrease blood flow as well as decreasing the pain. And sometimes you need other treatments that your doctor may prescribe to make your periods lighter, like the birth control pill, but used for cycle control, or a drug called tranexamic acid, or cyclocap. Some people have what we call premenstrual symptoms before their period, and those can include breast tenderness, bloating, back pain, mood changes, feeling sad, feeling irritable. Some people have a lot of pain with their periods, and this just makes them also feel grumpy. You can use pain medicine like ibuprofen, which is an Advil or Motrin, or naproxen, which is also over-the-counter Aleve, or Tylenol. But some people will need stronger prescription pain medications. Maybe heat can help, like a hot water bottle, and some people find that exercise helps the pain and may also help with the PMS symptoms as well. You don't have to only use pads. Some people can use tampons. Other people use something called a Diva cup, and they come in different sizes and shapes depending on how heavy your period is. You can have sex during your period as long as you and your partner are comfortable with it. There's nothing of concern and nothing bad will happen. But remember, this is always your decision. And you should be using condoms to protect against sexually transmitted infections and perhaps contraception of another kind as well to protect against pregnancy. However, you should be aware that during your period, bacteria can travel up the vagina and into the fallopian tubes and cause an infection. This can occur at any time during your menstrual cycle, but it's a little bit more common during your period, and that's again another reason why you should be using condoms. Some people really do have terrible periods. They're too long, they're too heavy, they're too painful. But you don't need to suffer. Your pediatrician or your family doctor or your gynecologist often can help. Maybe you need better pain medication. Maybe you need to be taking that pain medication regularly at the start of the pain. Some people will benefit from hormonal products like the birth control pill, and don't freak out, parents. The birth control pill is often used for cycle control to make periods lighter, shorter, less painful. Or other hormonal products like a hormone IUD might be helpful. If your periods are still irregular, it may just be that you're maturing and the messages from your brain to your ovaries to make the hormones that regulate your periods just hasn't matured yet. And some people will have prolonged times with no periods or never get their periods, and they should see a doctor. Maybe you need to have some tests just to make sure that there's no problem that can be fixed. If you've not had your period yet, it depends again on how old you are, and maybe you're just a late bloomer. Have you developed breasts or pubic hair? Has it been more than 2 years since you developed breasts and you still don't have a period? If you're worried about puberty or periods, speak to your parents and see a doctor, because either the doctor can reassure you that things are on the right track, or they may do some tests to see if there's a problem or suggest treatments to make your periods better.